about a year and a half ago, one of my good friends that I work with walked up to me and he couldn't stop talking about DocBook. He said, DocBook this, DocBook that, and was telling me how it's a fantastic type of directory that's on the iPhone as an application. And so he told me about the gentleman who was actually putting this together, Dr. Tim Jeremy. And so I worked with Tim in the operating room, and next day I bumped into him and kind of asked him a little bit about DocBook, and he started going all about it and talking about how DocBook's the greatest thing ever out there. And so I sat down with him one evening and we kind of discussed all the ins and outs of DocBook. And to me it was just such a perfect addition to the tools that a physician uses on a daily basis that it kind of wowed me. It wowed me enough to actually invest some of my own money into it. And as about a year ago, I've been a partner with DocBook. DocBook's helped me out in professional life in many ways. I serve on a couple different committees. One of them is a peer review committee, and I see a lot of physicians who get in trouble due to communication error or communication problems. And in a professional setting, communication is probably one of the very most important aspects of our job. We have to be able to communicate with other physicians. We have to be able to find them timely in an efficient manner. When you have the whole entire directory right here on your iPhone, it's very easy. It takes seconds to find the person you need to get a hold of. It takes seconds to call them. You don't even have to dial the number because the number is right there. It's just push the button and go. And being able to get a hold of that physician that quickly is important to me. I have a lot of things I have to do in my daily duties at my job, and wasting time is not acceptable. I can't do it. I've got to move forward. I've got to take care of my patients, and communication is top priority. One of the biggest pushes right now in medicine is patient safety, and to be able to accomplish patient safety and provide your patients with the safest medical practice out there, you've got to be able to communicate to your patients, but also to other physicians who are involved in the care of that patient. There's probably no patient that ever comes through the hospital is taken care of by one physician. There's always multiple physicians involved in your patient care, and to be able to get a hold of each other is incredibly important. So when I see other doctors asking the nurse to go find the Travis County Medical Society directory, which is a paper directory, it's great, and then the nurse heads off for 5-10 minutes and he or she can't find it or comes back and the phone number is wrong, and 30-40 minutes gets wasted to try to find one physician, I think about all the time that could have been spent on focusing on the patient during that time, but it's wasted for them. And when they see how easy it is to use their smartphone that they have on them, this iPhone, you get a big smile on their face and they see how efficient it is, and they quickly jump on board. You were asking about the times that DocBook has benefited me. I'll tell you a story. About 6 months ago, I was taking care of a patient early in the morning. It's about 6:30 in the morning. And as an anesthesiologist, one of the things you do is go see a patient preoperatively and make sure their history and physical is adequate, and everything's ready to go for surgery. And I had this patient in her late 50s, and she's telling me a little bit about herself. We're going through our history and physical, and her labs came up, and the nurse handed me the labs, and I noticed that the two values, the BUN and the creatinine functions, were way above normal. They weren't even close to normal, and if you saw these on a patient, you would think they were going into some kind of acute renal failure. But here's this lady who looked pretty healthy sitting there kind of chatting with me about how her big abdominal surgery she's about to have in the next 30 minutes. And I asked her, I said, do you have any problems with your kidneys? She said, well, I see a nephrologist, a kidney doctor, but he tells me I'm doing great. And I said, well, I've got your lab values here in front of me and they look pretty out of control, pretty high. I said, who's your nephrologist? And she looked at me with this big blank stare and she goes, he's got red hair and his last name starts with an R. And if I didn't have my DocBook on me on my iPhone, we'd be pretty lost, because you can't pick up the directory and find the guy with red hair who starts with an R who's a nephrologist. It's impossible. So I pulled out my iPhone and flipped to my DocBook and opened it up, and right there the general surgeon walked up too, and he's kind of in a hurry. He wants to get going. He's putting a little pressure on me to move along. And I told him, I was like, listen, there's something going on with the BUN creatinine functions for this lady's kidney. Let's look and see if this is correct. And I flipped open my DocBook, went into the nephrology section and started flipping through. And luckily there's not too many nephrologists here in town with the last name to start with R. And the lady actually pointed right to my iPhone and said, that's him right there. I clicked his picture. I called his office. His nurse answered in 30 seconds. I told him who I was taking care of. I asked him if this is a correct lab value, if this is out of the normal for her. And amazingly, they said that's not normal for her at all. Actually, there's something going on. And as we looked into it a couple more minutes, we found out she was on some crazy high protein diet that was actually pushing her kidneys over the edge. And had I taken that patient to the operating room that day, we could have really had some bad things happen in the operating room, because the last thing you want to do is take a patient into the operating room who may be in acute renal failure. And the fact that I could get a hold of that physician or his office that quickly and accurately was awesome. It helped out, and it actually 100%, I know that day, helped out that patient. The pharmacy feature is another fantastic feature. There's many times that we take care of our patients and we need to quickly find a pharmacy to get their prescription to. It's nice that I can open up DocBook, go right to pharmacy, go right to HEB, find a pharmacy closest to that patient's house and put the call in and get that taken care of. You'd be hard pressed to find a physician who couldn't use it. There's not a day probably in any physician's life when they're actually working and taking care of patients that they don't need to get a hold of someone else out there, especially another physician. And that's so key. That's so important to them to be able to get a hold of someone quickly. And you don't need to send your expensive nurse out there trying to find a book, a directory that's sitting in some closet or drawer or something like that. It's important that you can keep it on your hand, in your phone, and move forward.